Well, hello, everybody. I'm Jeff Yalden with Here Tomorrow. Hey, I'm down here in the bottom right. That's me. My friends, I'm honored to share with you a little bit about who we are here tomorrow, Mental Health Collaborative in Neptune Beach, serving Jacksonville. And on behalf of our incredible executive director, Hannah Hackworth, and our amazing board, I want to say thank you for giving us the opportunity to share this presentation with you. However, we can serve you and our community. Please reach out to us. Our information is provided. We like to think that we're a new approach to solving the suicide epidemic and eliminating the barriers to accessing mental health care in our community. So, moving along here, what I want to do is share with you a little bit about the learning objectives that I hope to get across to you. I want to help you gain the knowledge about the epidemic and how it's impacting our community. Also, awareness of Here Tomorrow's existence and our mission in our community moving forward. And interest in collaborating together to fulfill our mission to build a community where mental health care is acceptable and accessible. We're excited about what we're doing, and I can tell you in my 30 years of working in mental health and suicide prevention, there is nothing like this in the country. And we're right here in Jacksonville serving the beaches. Here's what we have if we look at the lives lost to suicide in Duval County and St. Johns County. You notice in the year 2000, on the bottom left here, we lost about 100 people to suicide. That's about 12.9 per 100,000. Up to 2019, it's 177 in Duval County. That's jumped from 12.9 to 17.4. In St. Johns County, in the year 2000, there was 13 suicides compared to Duval County, 100. In 2019, St. Johns County, they had 53, where Duval County had 177. You can see that Duval County is really struggling with the suicide epidemic. And there's many factors that go into that. But also, please understand, these numbers are as accurate as they can possibly be. Sometimes it's really hard to give you an accurate statement because on the death certificate, they don't have to put down suicide. Who's to say a vehicle accident, one car crash is not a suicide attempt, reckless behavior, but it could be accidental. So understand that a lot of these numbers are as accurate as they can be. Nonetheless, we have a problem in Duval County compared to the rest of the state of Florida. And that's why we're here to tackle that firsthand and to make a difference. And we need to work with our community. How do we do that? I'll tell you. Number one, we need to normalize the conversation and let people know they're not alone. And it's okay to not be okay. It's also okay to ask for help. And one thing that we really pride ourselves on is typically it's about 33 days to get seen by somebody, where we have same-day services, walk-in welcome, and we're working with community organizations where you can get seen within 24 hours, 48 hours at the most, but most of the time, same day. Dr. Paul Quinnett, QPR out in Seattle, he says if we require people to ask for help, they will continue to die. What he's basically saying is we have to do a better job of finding our at-risk community members and help them where they are. And one of the ways that we do that is validating where they are, supporting them, listening, compassionately listening. And Dr. Quinnett, his program QPR is question, persuade, and refer. And we could talk more about that. We also offer presentations where we can come to you and share his program. He also says those who are most at risk for suicide are the least likely to ask for help. One of the things I want to challenge you to do is know the signs or the red flags, because people can't get help if we don't know that they need help. And if people don't speak out, they will be acting out. And those are the red flags that I want to share with you. Suicide does not end the chances of life getting worse, but suicide eliminates the possibility of life getting better. So, suicide is the most preventable form of death. Again, we have Duval County from 2010 to 2019. And as you look at these stats here, you can see in 2010, 113, all the way to 2019, 175. In that 10-year period, 1,413 suicides. The unknown is an extra 16 for a total of 1,429. Now, that's all of Duval County. If you look to the right on your screen, you'll see resident deaths by suicide in the beach communities. That's Atlantic Beach, Jacksonville Beach, and Neptune Beach. Our office here tomorrow, we're in Neptune Beach, serving specifically the beach communities, but all of Jacksonville. Atlantic Beach, in that 10-year period, 41. Jacksonville Beach, 62. Neptune Beach, 17. For a total of 120. Now, this is from the Florida Department of Health Bureau of Vital Statistics. We can definitely go further into this. We can talk more about age groups. We could talk about some of the reasons why, from teenagers all the way up to our elderly citizens. There's many factors that go into it. What I want you to realize here is that here in Duval County, the beaches, this is a epidemic that is really challenging our healthcare system, that we all collectively, we need to get comfortable being uncomfortable talking about this for all of us to be able to make a difference. When we solve the problems that kill people themselves to solve, the reasons for suicide disappear. Dr. Quinnett says that. So again, if you're looking at death by suicide, the zip codes, you can look at drugs and biological substances. You can look at other causes, unspecified solid or liquid, gases, vaping, hanging, strangulation, suffocation, firearms discharge, jumping from a high place, and other unspecified reasons that someone might want to make a forever decision. These numbers here are really staggering. As you look at firearms discharge, mostly a suicide attempt by male will predominantly be by a firearm. And if we're in person, I can get further into this. I don't want to add stressors, as I'm just trying to educate you in a little bit about who we are and why we're doing what we're doing. But these numbers are staggering. They're informative, and it's important that you know that. Again, the Florida Department of Health Bureau of Vital Statistics. You may never know what results come from your action, but if you do nothing, there will be no result. Gandhi. I like that. Another thing that I want to share with you is, I don't know who you are watching this. One of the best ways that we can take the thought to the action of someone that might be suicidal is putting space between thought and an action, is the relationship. Remember, people want to know, can I trust you? And do you care about me? You are so more than capable of intervening and asking the question and persuading people to get help. So ultimately, we want to get these people to the mental health professionals, but at the onset, we need to reduce the anxiety, not leave them alone, be present, remember, validate, support, be non-judgmental. When we can do that, we're going to make an incredible difference. And you staying calm while they're in distress is going to be incredible. So again here, you have Atlantic Beach, Jacksonville Beach, and Neptune Beach. It's broken down in that 10-year period by female, male, in all three of the beach communities. Again, you can see male is predominantly more than female. What they say is for every, it's almost like 4-2, 4 males to 2 females. And there's reasons, and I'll try and make this really short. A friend of mine, Dr. Alex Crosby, the Center of Disease Control and Prevention, they did some research on why men, the age group of 35 to 50, what they did is they did research on the brain of those that ended their lives by suicide, and they noticed that there was an incredible amount of trauma that was never dealt with. Now, I'm going to go out on a limb and say that I think women are stronger than men. Maybe not physically and weightlifting, but I think when it comes to emotions, when it comes to our mental well-being, women are far more stronger than men. Also, women are more in tune with their feelings. What Dr. Alex Crosby said is, think about it. You're a male, supposed to be tough, macho, I got this. And so we hide our feelings and thoughts. Like, I'm good, I'm all right, I'm going to grind through this. Again, if you don't speak out, you will act out. If you don't learn to ask for help, then you're not going to have good coping skills and problem-solving skills. So as you get older and your obligations and responsibilities become bigger and greater, well, when something happens that's pretty severe and you don't know how to communicate, you don't feel comfortable sharing your feelings, you don't have coping skills, problem-solving skills, sometimes suicide is not just something that is planned out, but it could be an emotional reaction to something that has gone wrong. And remember something, suicide is the most preventable form of death. And it's not that people want to die, but they want the pain to end. And so by us sharing and communicating, we're going to do a great job of giving people permission to open up their heart, and the pain will soon end. Maybe not today, but patience in the process, do the work, great things happen. Again, here we have all the numbers from 20 to 85 in all three of the communities. And I can share this PowerPoint presentation with you that you can spend as much time as you want pausing it. But I just really want to let you know, again, who we are and why we're doing what we're doing it here tomorrow. What does our community think? Well, when you look at this, the health challenges in Duval County, you'll see that mental health, violence, and addiction are the top 3. Mental health and addiction, they go hand in hand. Which one comes before the other? I don't know. Who's to say? But a lot of times, addiction and mental health, dual diagnosis, people self-medicating and being seen by a mental health professional and being on medication it's a game changer. You cannot be self-medicating and also be under the care of a mental health professional on medication. It just negates everything. If you would ask me what's more important, therapy or medication, I think medication is like a Band-Aid. It's important, but therapy gives you tools. But if you use both of them, I think that is incredible. Also, you being responsible for your self-care plan. Reasons why this is such a challenge. Number 1, the stigma. People are afraid to speak up. It's okay. Not affordable. Insurances. And I don't want to place blame there. The more we talk, the more improvement we're going to make. And it's not accessible. This on the right side of your screen statistically takes 33 days, the national average, for an initial behavioral health appointment. If somebody's in distress, crisis, and they can't get seen for 33 days, that's a whole month. So much happens in that time. That has to change, and that's what we do at Here Tomorrow. We can get you seen today, get you seen tomorrow. We can help you with a success plan. We can intervene in that time between thought and action, and we work with community organizations. We'll get you in within 24 hours. The average cost, it's expensive, about $100 to be seen by a professional. We at Here Tomorrow, it's incredible. We provide no-cost services and provide up to 6 different appointments with a professional at no cost to you. That's amazing. Nothing like this in the country. Mental health professionals available in 50% of U.S. counties. 0. 2 out of every 3 people in the U.S. with a diagnosable mental illness never seek treatment. 2 out of 3. I think that's our fault. I think it's our fault as people that love and want to serve one another. And I think it's our fault because we're hiding and we're not willing to engage in the conversation and give people the support they need. And so I think we all need to do a better job of that. And that's why, one of the reasons why Here Tomorrow exists. We want to normalize the conversation and let people know it's okay to not be okay, and it's okay to ask for help. Mental health in the pandemic, as you can imagine, and those numbers haven't come out, but this pandemic, the unknown, has really put a lot of strain on people. Suicidal thoughts increased during the pandemic. In 2018, you can see 10.7%, but in August of 2020, that jumped up to 25.5%. All ages, it went from 4.3 in 2018 to the middle of the pandemic, 11%. My friends, please understand Here Tomorrow. We provide free education to our schools, to our community, and to local organizations. Reach out to us. We'd love to come and provide an inspirational, thought-provoking, answering your questions type message and let people have permission to, it's okay to check in with one another. Talk about self-care, whatever we can do, please reach out to us. So we want to let people know that recovery from mental health conditions is certainly possible. It's really not that hard, but you got to be willing to engage in the conversation and be willing to do the work. What's the work? Self-care is not selfish. It's very important. A lot of people said that when they're supported, love, validation, listening, compassionately listening, that's one of the most powerful forces on earth that can change and inspire someone even when they're at distress in their life. So what we at Here Tomorrow, we provide a physical and a virtual space where people feel loved, supported, and inspired to take the next step in their lives. We don't use medical terminology. We use everyday terminology. We want people to feel comfortable. We specifically are not mental health professionals, but we're a mental health collaborative that can get you seen by mental health professionals quicker than if you were to go on your own. Again, my friends, reach out to us. You'll be thankful that you did. So our vision, everyone wins when we achieve our vision that all community members in need can access mental health care and live full, meaningful lives. Our mission to transform lives by building a community together where mental health care is acceptable and accessible. Our core model, educating the community, normalizing the conversation about mental health conditions, also addiction and mental health. And we want to do everything we can connecting those seeking help with the resources they need when they need it most. So this slide right here is about the stages of change. A lot of people come to us in the pre-contemplation stage. Maybe a family member calls us. The contemplation stage is people are aware of a problem that exists, but they don't really have a commitment. And by being supported, we can take them from contemplation to preparation, thinking, maybe I do need to do something. And ultimately, we want to see them into action where they're going to start making modifications in their behavior and doing the work that's necessary for them to live meaningful, fulfilling, and rewarding lives. On our website, heretomorrow.org, this is amazing. Dr. Paul Quinnett, again, QPR founder, he has a maze that if you're suicidal, men, women, listen, I don't care if you're a man or a woman. I think this maze works for everybody. And it's like a game where you go in and there'll be a question, you answer it, and they say yes, no, well, let's rethink that. Let's take a step back, take a step forward. It's amazing. You can go to our website at heretomorrow.org. Check it out. We have great resources, and you can take it on your own without the stigma and see where you stand. And I think that might be a powerful tool for you to might think, I'm going to reach out to these people. Please do so. Love to meet with you. Our strategy is we want to disrupt the current trend. And again, I want to support mental health care and say we're doing the best we can with what we have. Do we need to do better? Absolutely, and we're trying, but we need everybody's help. But the current trend is not necessarily working, and we want to disrupt that. So we collaborate with national experts to bring that advice here to Jacksonville, Florida. We are creating and doing something that has never existed. It didn't exist before, but we are proud of the model that we're bringing to our community. We want to eliminate the barriers that prevent people from getting the help that they need. So we're going to do this through a tactical approach of educating our community. But again, we need to be inspired by you asking for us. We just can't show up. So reach out to us. We're changing the conversation by telling the stories. My friends, we all have a story. We're not afraid to tell ours. Me, personally, my vulnerability has been my strength in recovery as a man living with mental illness. And I'm proud to tell you my stories, what I've learned, and what living in recovery means, and the work that's required to get there. But I want to help you help others. We're a unique solution. We know we are. We're a different approach. And we're a bridge from people going from where they are to where they need to be, giving hope and a positive tomorrow. So we want to work together. We want to give hope to people. And ultimately, you know what we're going to do? We're going to save lives, my friends. Here tomorrow, we exist to offer a warm, welcoming physical and virtual space to have conversations about mental health. Hey, walk in our doors. Come into my meeting space. Let's sit down, talk. Especially if you're a man. I love this conversation. Even if you're a woman, how can I inspire you, support you where you are? How can I help you develop the tools for you to know what you need to do? Reach out to us, my friends. You are a hero. Again, I want to make sure you know that you're more than capable of intervening and asking the question and questioning people, persuading them, and referring them to the right people. Remember us, heretomorrow.org. How we help people. We're a meeting place. We work with you hand in hand. I promise you, we're not going to leave you alone. And you know what we do? We follow up with you every 3 days, 7 days, 10 days. So we go from like a week, less than a week, a month, 3 months, 6 months, 9 months, a year later. We are constantly on your terms following up to check in with you to make sure that you're doing okay. Once you meet us, you're a friend forever, my friends. We want to be able to let people know where they can turn. Again, we stay connected together on social media, in our meeting spaces. We exist to make a difference to you personally, but to our whole community. We're also a mobile mental health crisis support. I don't want to say crisis intervention. Again, those are the professionals. But you need crisis support, someone that can help you in that moment between thought and action, or just breathing and lowering that anxiety. Reach out to us, and I promise either myself or we have people will be there in a heartbeat. I promise you that. We cannot solve problems with the same level of thinking that we use to create them. So you know yourself better than anyone else, but we're here to explore options that work for you on your terms to get the help you need when you need it most. And again, we collaborate with organizations to get you in immediately. And these are mental health care practitioners. We have psychiatrists on our board. We are working with community organizations that is going to help you, again, where you are and when you need it. And look at this, return on investment, executing our mission, American cost benefit, 6-to-1 for investments when we link you to the services and counseling that you need. I think that's incredible. Annual costs when it comes to suicides and suicide attempts, about $93.5 billion. You know the average cost for a suicide by firearm inside the house to have cleaned up? It's about $77,000. That's the insurance money. My friends, suicide is a permanent action to a temporary problem. But again, we need everyone to open up in this conversation and let people know there is help. We can save lives. My friends, we can do it together. But I promise you, let us at Here Tomorrow be of service to you, your family, our young people, our workers, our law enforcement, our military, our first responders. My friends, we love you. We love our community. And we are proud to be here tomorrow helping and inspiring each and every one of you. My friends, I thank you so much. I'm Jeff Yalden. I appreciate you giving us the opportunity of sharing a little bit about who we are. Take care, my friends, and we're at HereTomorrow.org.